health equity through community-engaged research and innovation, which will strengthen our capacity to conduct impactful research that improves community health locally and beyond. This aligns with Wayne State's mission to serve our urban community and find ways to reduce health disparities. This year also marks the College of Nursing's 80th anniversary. Thank you. I am honored to introduce Dr. Yurmika Jefferson, Associate Professor in the Department of Women, Children, and Family Nursing. Her extensive clinical background spanning over 16 years has illuminated the impact of implicit bias that it has on breastfeeding support. She centers African American parents' voices to improve breastfeeding practices and expand inclusive maternal-child health strategies. We are thrilled that she's here to share her insights on bridging the gaps in breastfeeding support through a culturally resonant mobile health intervention.
I think that one of the most impactful parts of the presentation was looking at the rates of breastfeeding and really how we see a lot of differences between races and ethnicities, and it's really important, especially with community engagement, to work hard so that we provide equitable care to those that don't feel as though they are being welcomed in a healthcare setting. And further into recognizing the inequities is identifying the specific details within the cultural context, resources, behavioral environment aspects, getting the specific details and information about what exactly we can be supporting and involving them in providing their lived experience and how best we can support this.
It was really exciting to see everybody be engaged in community engagement and research. I was really nervous to get started, but now that I'm having conversations with everybody afterwards, and it has been really great.
I thought the community researchers were really inspiring. I think, I'm actually in the process of looking into building a community board related to my research, and so I was taking a lot of notes about things that the community researchers did.
Yeah, I also took a lot of notes, especially around strategies for building those community partnerships, and I really enjoyed hearing from the actual community members who have benefited from some of this research and how they were able to get involved and see those outcomes through.
And we were able over Zoom to record some data and kind of get some key things, which include Wi-Fi connectivity issues, digital literacy barriers, technology-related anxiety and fear. We had a lot of seniors who talked about password management difficulty. They would have an email but would not know how to log into their email account. So after we created a computer concerns and resource fact sheet to address those needs for localized resources throughout the trip. So after that, we were able to have that finished final version of that technology toolkit, which you can access here.
I'm so glad to see community engaged research highlighted in this conference, to be able to present with a lot of people that I collaborate with and elevate their voices and give them a chance to share the microphone.
And we saw that 53% of our participants actually failed on these
I truly like understanding how they would deal with like the older population there, and like something that I felt was kind of sad was like, you're old and you're in prison, and like most of like the stuff that you would need, mobility aids and like such, I don't know if they would really allow it in every prison system. So like I wonder what type of accommodations they would have for them. And when the lady said they were introducing more of like the like housing type facilities for the older age population, I was kind of happy with that, because like I'm not trying to say like everyone like they're serving their sentence, yeah, but they're also like human beings, and in your old age, I feel like you should be allowed to have certain things that would allow you to feel comfortable within that age.
I definitely agree, and something that also like stood out to me is the fact that like it kind of reminds me of psych. Like you go into your psych clinic, you see like these older people, and you're just wondering like, I feel really bad for them, but at least they're getting the treatment that they need. But at least they had mobility aids. They had someone that was like actively caring for them, giving them their medications. But in this prison environment, like they're seen as criminals. Unfortunately, they're a good chunk of people, so they're not getting accommodations. Like, how is it fair to punish an older person because they can't hear you? Like, you have to consider that you might need to speak up a little louder, or maybe give them their directions. And also, like she said, like with the lighting and stuff, like I feel like even if it's hard to like pay for a lot of those accommodations, maybe you can start off by like designating a certain area to the elderly, well, like make that area well lit, put handlebars in those cells. Like you can, I feel like there's a way to make it work, and I really hope that in the future that people do advocate for it, and that people do like try to get them what they need, because they need it too. They're humans, like you said.
About the prison system, I'm concerned about that. I'm very much interested, and I was glad to hear what I did today, because I connected with the presenter, and I will be at some point trying to get involved in that. I care about returning citizens that are seniors and maybe don't have any experience with technology, and once they're out in the world, they need to know that, because it minimizes them returning.
But I'm working within the vulnerabilities of our community as well. After my career really was based on looking at behavioral symptoms of persons with dementia in long-term care facilities.
Mistrust of healthcare system, as we know, is another huge piece where, again, individuals have been hindered from getting care because of their either their experience or stories that they've heard. This sums up that we need to be really listening to the population that we serve and really talking to them and really getting information on how to provide tailored and culturally appropriate care.
It was actually at just a local thing that had more community partners than researchers. It wasn't really a research conference. Think about that too, like what is going on in the community that's local, where things are actually being disseminated to members of the community or to organizations that are serving the community, because those can be really important.
Every session that was presented today, every presentation really had a common theme that just wove through the entire day. Everyone I spoke to felt like they were very engaged, very applicable, and just the mood in the room was just amazing. I think it was really an impactful conference.